Today, we are drawing the curtains to understand what happens during dialysis, and we are joined by a nephrologist nurse, Karaoke. In order to understand what happens during dialysis, one needs to understand what kidney failure is. Kidney failure occurs when your kidneys lose the ability to filter waste from your blood. One is prone to kidney failure if he or she has diabetes, high blood pressure, or a family member with a kidney failure. Once one has been diagnosed with kidney failure, he or she is scheduled for a weekly dialysis. Karaoke explains what happens before dialysis.
A nephrology nurse is known to be taking care of patients who are on dialysis, that is initiating dialysis and monitoring them through dialysis. Normally when a patient has renal failure or person who is on dialysis, that means they have impaired renal function or kidney function. So the kidney are literally not functioning, or they are not functioning optimally. That means they could be having fluid overload, because if this patient takes a certain amount of fluids, that amount of fluid tends to accumulate in the body. So for you to tell how much of that fluid or accumulation of that waste need to be removed from the body, because basically the dialysis machine is actually the kidney. It's serving as a kidney for the patient, because at the point that patient doesn't have a kidney. So they check their weight. You might find out that in 2-3 days, because they normally have 2 to 3 sessions in a week. After one session, the patient might have added around 2 to 3 kg, depending on the fluids they take. So that's the amount of fluid that you are going to target to remove from the machine. That's actually what we call ultrafiltration. So basically that's the main thing that you do before a patient does, because that is on his part, on her part. They check their weight, or you actually check their weight for those whom you really need to help. Then you need to do a physical exam, because a patient may be just looking at the patient, the breathing difficulties, the way patient present at the renal unit, they present differently. When a patient comes and they are having maybe short breath, very difficult breathing, you do a physical exam from the head to toe. You check you check the limbs, the upper limbs, that's the hands, the lower limbs. You see if there is edema, all the kind of, if there is maybe, you can even feel the breath of the patient, because some will have maybe, because depending on the diet they are taking, they may have uremic breath or not. So you can actually, that can help you to assess what you are going to do with the machine, because there are so many settings you are going to input in that machine, so that it can actually help the patient. Maybe check, you are going to set the ultrafiltration level. Maybe the patient added 3 kilograms in 3 days. That means you are going to target around 3,000 to 3.5 liters, so that patient will leave dialysis at almost normal, how do I call it? The patient will feel the improvement, or actually going to report that improvement. So That's I'm talking. That's only one part. The ultrafiltration. Maybe the uremic breath might tell you the patient has very high urea levels, so you know what to set in the machine if the dialysis flow, because when you set a very high dialysis flow and the urea clearance is too high, the patient might have complication. So there's a whole lot of things you have to check for before you connect that patient to the machine.
According to Karaoke, the number of dialysis a patient requires in a week depends on many factors, including one's weight.
The patient should be on dialysis for 12 hours in a week. That means they should be having at least 3 sessions in a whole week. But currently the hospital insurance fund only caters for 2 sessions in a week, which is basically okay and enough for a patient. So that means a patient has to be on dialysis for at least 6 hours so to cater for those 4 hours. But because of many factors, it's only allowed to be on average 4 hours 2 times a week, which is substantial. It's just enough for a patient on dialysis. As long as it's regular and consistent, without defaulting on those sessions. And also, it can also be determined by many factors. Patient's weight, patients who have, there are patients who cannot tolerate dialysis for 4 hours, which happens to be too long for them. So some of them might end up dialyzing for 3 hours. That can also be determined by the creatinine levels. It's a factor that determines the renal function. There's some patients who still have residual renal function. There might be several patients on dialysis, but the level of kidney damage is different, or the cause of the kidney damage could be different. So some might some might even need only 4 hours in a week, unlike the others. So, but that does not mean that they are getting better. They could be getting better, but they could have been diagnosed earlier. That's why maybe they don't need dialysis twice a week. They need 4 hours. Basically, it's 4 hours a week.
A key element in care of kidney patients is diet.
Renal patients, the care is vast, but basically the main thing is the diet. Diet for a renal patient, diet is really important, because the kind of diet they take can determine so many things. Even their life they could even put their life in immediate danger. Talk of food that has high potassium, like potatoes and bananas. So these patients tend to be on a strict diet, and I tend to say that their meals are not for luxury. They don't have the luxury of diet, because they're on a very strict diet, because their kidneys are not functioning. The functions of the kidney is to clear the toxins. Some of these toxins are poisonous, and they can be actually very poisonous, and the effects can be immediate, because when a patient ingests something that has high potassium, it tends to show immediately. It tends to manifest in a very short period of time. Loss of muscle tone. The same thing happened to the heart. A condition called hyperkalemia could kill the patient very fast. So
what's the recommended diet?
Very low urea, not entirely very low potassium food. Actually, no potassium food. Although potassium is still a very important, it's an important electrolyte in functioning of the muscles and muscle tone. But for a renal patient, we have to be at the least. So the diet, low potassium food, urea. Urea. I'm talking of urea as compared with protein food. They take protein food, but on a moderation, because the higher you take, the more urea you have and the more complication you have, because the higher you have, the if you have very high urea, you're likely to have uremic syndrome, and it's going to be, it's actually become very difficult even managing. For instance, a patient who has a very high urea will likely continue having low hemoglobin levels, because when they are given some injections like the erythropoietin injections and the associated medication that boost their blood levels, they tend not to function very well in a body that has high urea levels. So basically, I will talk of moderate protein and a very low potassium diet. The machine basically cleans the toxins from a patient's body, just like a kidney does. So we have a dialyzer here, which is basically the artificial kidney. And then we have a pump here, as you can see, it's running. That's a pump that draws blood from the patient and take back the blood from, it initiate the blood movement. We have an anticoagulant here, heparin. This prevents the blood from clotting when it's outside the patient's body. And we have a bicarbonate here, and you have acid concentrate here. The mixture of that forms a certain conductivity that helps draw toxins from the patient's blood in the dialyzer. In this dialyzer, there are two compartments. There is a dialysis compartment and the blood compartment. There are two compartments separated with a membrane. So the blood flows from this direction, and the acid concentrate flows from the opposite direction, a countercurrent movement of the blood and the concentrate. So when the blood flows in this dialyzer, for a continuous movement of blood in that dialyzer, there is a process of diffusion takes place, so the toxins in the blood are able to be removed as a continuous procedure when the dialysis is going on. Basically, that's what happens, because what is most of the electrolyte in the acid concentrate are what is normally in the human body in normal levels. So that continuous diffusion process, it continues until there is an equilibrium, so that the toxins in the body, which happens to be at a higher level, are brought back down to the equilibrium. Basically, that's the basic about dialysis. I think as the days are passing by, more knowledge is coming through, and people are being managed better as the days passes by. Because, for instance, you are able to assess the patient's how the patient is able to cope with the dialysis, measurement of blood pressure, how much fluid you are supposed to ultrafiltrate from the patient, because you are talking about a patient who is on dialysis, who doesn't pass urine. Whatever they take, whatever they eat has to be, depends on the machine for clearance. So with the issues like the lab work and all that, you can be able to assess how you are going to manage that patient here. And there are so many settings you can, how many hours you are going to dialyze that patient, at what flow rate you are going to dialyze that patient, depending on maybe the patient has very high urea levels. You know this patient is going to dialyze for a period of 2 hours today, for the sake of to prevent patient from developing a complication like disequilibrium syndrome, or even how much fluid you set to remove from the patient. It's going to help you know if that patient, how much fluid you're able to set so many things, and depending on the patient, how to so that the patient can be able to cope with the situation. So that's the difference in this hemodialysis machine. There are hemodialysis machines that can actually initiate hemodiafiltration. That they prevent the patient from developing hypotension easily in the machine, especially those patients who are hemodynamically unstable, who can easily have blood pressure dropping in the machine. For instance, maybe because of the bicarbonate influence, it can result to a loss in blood pressure or hypotension. So it's just like different models of a car that happens to be a better performing car. The same way happens with this machine. They have better functions. There are different types of machines, but that can offer patient optimal care depending on the age of the patient, the condition of the patient, those patients with cardiac issues and all that.